to introduce the presentation today at Celebrating Champions of Change. And we're very, very excited to have Carla with us. And Carla Arpa is the assistant manager of the medicine program. She has over 25 years of nursing experience in a variety of different areas. And she was previously the professional practice RNAO lead. Carla is passionate about advancing quality initiatives and optimizing nursing workflows to enhance patient care. And we're very excited to have Carla with us this afternoon. And I am going to hand it over to you, Carla. Thank you so much.
So much. And I'm so excited to be here. Thank you. I always love being part of the RNAO family. So today I'm going to talk a bit about, I'm going to look at Osler at a glance, our governance infrastructure, our BPSO journey, the BPSO program, Enquire data, how we've used it, our champions, and of course talk about the event Open House, which I was so excited to be part of, and the next steps for our BPSO here at Osler. So William Osler Health System is one of the largest community hospital providers in Canada. Osler is the major health provider for Brampton, North Etobicoke, and surrounding areas, providing care to more than 1.3 million residents. Osler is a large multi-site hospital system with 5 locations that are home to a broad range of inpatient and outpatient services. We are a leading hospital for medical education and training for emerging healthcare professionals, including physicians, nurses, and allied health practitioners. And we have now academic affiliations with Toronto Metropolitan University, as well as Humber. Our emergency department and urgent care centers are far, go back one. Are far away the busiest in Ontario, averaging well over 800 patients per day. Our Osler 5 sites are 2 acute care hospitals, Brampton Civic Hospital and Etobicoke General, an ambulatory facility, the Peel Memorial Center for Integrated Health and Wellness, a withdrawal management center, and a reactivation care center for restorative post-acute care. So the BPSO steering committee has been embedded within Osler's governance structure from the pre-designation period. And the BPSO steering committee reports to the nursing advisory committee, which then reports up to the executive leadership and board of directors. And they receive updates on all of our BPSO activities. So Osler began the BPSO journey in April 2021 and was awarded BPSO pre-designate status. But due to the peak in the wave 3 of COVID at that time, strategic preparations occurred to support building organizational structure for BPSO. From July to December 21, interdisciplinary BPG working groups were established. Monthly meetings started for each of the falls, pressure injuries, people-centered care, BPGs. The BPSO steering also was initiated in August 2021. And this team meets monthly and reports directly to the Nursing Advisory Committee. During this time frame, each of the BPG working groups completed gap analysis of current practices and compared to the best practice guideline. And it included frontline staff engagement. In November 2021, we launched the BPSO program organizationally, leadership unit roundings, pinning ceremony for preceptors, games and prizes, and information sharing. In January 22 to present, multiple practice changes and educational sessions have occurred and are still in progress for falls, people-centered care, and pressure injuries. All of these changes have been identified through our gap analysis process, and to ensure success, we are evaluating the initiatives through auditing and data collection. We are required to report specific indicators to the RNAO monthly, and we currently report on falls, people-centered care, and human resources. and transitions in care. In February 2023 to present, they initiated 2 more BPG working groups, and that was the foot ulcers for diabetic population and the transition in care and services. And as part of the groups, the gap analysis were completed as well, and plans are in progress. In June 2024, we achieved designation, and we continue evaluation, sustainability planning, and dissemination activities throughout the years. So this is the BPSO program at a glance. So from 2021 to 2024, 5 BPGs were implemented, and that was the people-centered care, assessment and management of pressure injuries for the interprofessional team, preventing falls and reducing injuries from falls, transitions in care, and assessment and management of foot ulcers. And for the 2025-2026 year, Osler has begun implementing the Working with Families to Promote Safe Sleep for Infants 0 to 12 months of age and the practice education in nursing. So Enquire data indicators are used in discussion in the BPSO steering committee that occurs every month. And each BPG lead is present and they provide an update on how the organization is performing on different data indicators. So examples include the fall indicator, people-centered care, the human resource structure indicators to help identify improvements, trends, to align with the best practice guideline implementation with a goal of improvements and sustainability. The data is used to inform decision-making on quality improvements and the next steps for our BPGs. The Enquire data is in alignment with Osler's quality improvement plan and shared with the executive leadership team. We currently have 3 indicators in alignment for the people-centered care percentage of respondents who responded always to the following questions. Were you involved as much as you wanted in your decisions about your care and treatment? The number of falls, excuse me, with harm per 1,000 patients, days on the best practice spotlight organization units. And the third BPG is, that part of the clip is the transition in care to improve transition to seniors. So Osler has this quality improvement plan with the 3 goals that I've outlined previous with the number of falls. And you can see we have been achieving that through our best practice organization, BPSO units, and our dedicated education units, DEUs. And you can see here on the slide that it's went from 1.17 to 1.12 currently. And the second percentage of respondents who responded always to were you involved as much as you wanted to be in your decisions about your care and treatment, that is currently being collected. So there's no current data. We did collect it previously, but we did a change in language. So we're restarting the data collection. And then we are also looking at our alternate level of care or ALC rates. And they have decreased with the implementation of the transition in care BPG. So champion engagement, this is probably the best part that I loved in the role, is being part of encouraging champions to be part of the organization and part of change. So some key engagement strategies for champions, staff, and visitors. One of them was the Fall Prevention Month exhibit. So this was actually the second year of the Fall Prevention Month exhibit. It was located at 2 sites, Brampton and Etobicoke. It had over 100 staff and visitors attend. It had vendors as well, teaching all about fall prevention. Multiple champions helped to support the day's events, and vendors shared new strategies to keep patients safe. This was also a great opportunity to recruit more champions. The second opportunity was in the incident and prevalence study that occurred in March of 2025. And this included all our wound champions or future wound champions to support patient assessments and data collection on the wounds. The event incorporated education and assessment skills for champions to learn and grow in the role. Right, so this is just a few of the champions. This was at the event open house Champion of Change that occurred on Thursday, May 15th at William Osler Health System, Brampton Civic. So 21 practice champions attended the full day event. And this started in the morning with a meet and greet with our RNAO lead and practice champions across the organization. Breakfast was served during the keynote address by Tiziana Rivera, the Executive Vice President of Quality Research and Chief Nursing Executive. Carissa Cordon, our Associate Vice President of Practice and Academics. Veronique Boscart, our Chief Scientific Officer Research. And Tanya Imafadon, our Manager of Respirology at Brampton. So we all got to spend the morning together, getting to know each other and really encouraging and highlighting the champion role in our organization. So currently, Osler has over 500 champions in various roles across Osler's 3 sites. Over 50 champions have active roles in falls and wounds, providing auditing and education on medicine and surgical areas. And during that event open house, champions were dispersed all over Brampton to share the event details. And we shared this QR code to help recruit more staff to become BPSO. So it was a pamphlet that was left on all the units. They can scan the QR code and get more information on how to become a champion. So the main event open house was hosted in the atrium at Brampton. So there was over 100 staff, patients, families, and visitors that were welcome to engage in 12 interactive booths themed around the BPSO Island Quest. The interactive booths included information and resources about becoming a champion, the Advanced Clinical Practice Fellowship, and the 5 BPGs that we incorporated in our organization. So people-centered care, assessment and management of pressure injuries for the interprofessional team, preventing falls and reducing injuries from falls, person and family-centered care, transition and care and services. Each booth was supported by the BPG lead and champions. In addition, we had 2 vendors, Stryker and Baxter, that also helped to support the day's event. A dedicated survey booth captured feedback on participants' experiences and assessed knowledge gained regarding the RNAO BPSO initiative at Osler. Each booth offered valuable information and resources, interactive games and treats. Participants were invited to attend all 12 booths to collect 1 puzzle piece at each booth pit stop. At the final booth, participants assembled the puzzle and submitted their name in the draw for a prize. So the event was a resounding success. Practice champions had the opportunity to meet with leadership and one another, reinforcing the importance of their role. The atmosphere was described as energetic, engaging, and informative. Staff gained a deeper understanding of the BPGs, the champion role, and the opportunities such as the Advanced Clinical Practice Fellowship. Leadership noted a positive culture shift and a renewed energy towards RNAO initiatives. Champions reported feeling valued, motivated, and inspired to continue their work. Many expressed interest in attending similar events in the future. Since the event, there has been a noticeable increase in interest from staff wishing to become practice champions. Educators have reported increased inquiries about how to get involved. Staff also expressed a desire for the event to be replicated at all Osler sites moving forward. We had the pleasure of having Janet Chi, Associate Director of the Long-Term Care Best Practice Program at the RNAO, and 2 international BPSO guests from China attend. The guests had a chance to explore all the work at Ulster and meet the teams that are leading the best practice guidelines. Feedback from Janet Chi and the guests was highly positive, sharing that they had a great experience and learned a lot about the RNAO BPSO program at Ulster. Janet Chi expressed how the Ulster event did a great job showcasing RNAO and the work, and that has been achieved. Our diabetic foot team also welcomed some guests from St. Michael's Hospital. The guests obtained information and resources from the booth, and the lead brought them to the unit for a tour and further information sharing. So some of the summary of feedback from the participants. A survey was conducted at one of the booths on the BPSO island. Of over 100 participants, 59 completed the survey. The questions explored the participants' increased knowledge of the BPSO work and if they had gained new knowledge and strategies. The analyzed results showed that 88% of the visitors were aware of what is a champion. 92 identified what ACPF stands for, or Advanced Clinical Practice Fellowship. 100% answered true that FALS is a best practice guideline. And 96% of visitors strongly agreed that Ulster is providing excellent care as doing excellent care. Over 80% agreed or strongly agreed they would return next year, and 96% said they would attend a similar event in the future. Suggestions for improvements next year are to make the event more interactive, more convenient location, and to have better food. 92% agreed or strongly agreed they found the Quest BPSO Island fun. So some ideas that came from the retreat that was just occurred earlier this year was ways to try to engage more of our champions just beyond falls and pressure injury BPG work to include other BPGs, providing some professional development opportunities such as committee engagement, conferences, and presentation opportunities, reviewing current practices and looking at opportunities to streamline and standardize how we do BPSO at Ulster, and ways to increase the visibility of the BPSO work here. Thank you. So that was a great opportunity to be part of the event open house funding that is offered by the RNAO to really engage our champions. And I really appreciate this opportunity to share it with everybody.
Oh, thank you so much, Carla. That was amazing. Really enjoyed all the pictures and such of your open house, and that the little scavenger hunt around the island stuff. It reminded me a bit of Survivor. Which I thought was great. A nice theme for that for sure. Yes, thank you so much for sharing about your team's approach and celebrating your champions. There is so much to learn from all your success that your team has achieved, as well as very successful navigation through your BPSO pre-designate journey. And congratulations on your designate achievement as well. So